There's a sign on my door right now that the kids love. This is in this space, you can be yourself. You can be free, and kids value that. They value being able to come into that office and then having a secondary space to go into where they just get to talk about any and everything. It definitely feels like a safe space for them, yeah. My name is Isha George, and I'm a licensed clinical social worker at the Children's Hospital of Philadelphia. And I currently work in their school-based mental health program at Girard College, working with students grades 1 through 12. I love being here 5 days a week. I'm in classes. I see the kids at lunch. I see them at recess. Access is key, and the kids have access to us.
If it's considered bullying, are we ignoring it? Are we reporting it? Are we saying something?
The state of mental health across the country is dire. And in Philadelphia, it's even worse, with just approximately 22% of students receiving the appropriate mental health care when they need it. Providing school-based mental health services is really important because it not only increases the access that students have to mental health care, it also reduces the stigma because it just becomes part of their everyday life.
The common concerns that we see are anywhere from depression to anxiety, ADHD, PTSD, trauma. These concerns would probably normally get misdiagnosed or just not addressed at all. And us being at a school, we're able to meet the students' needs.
Hi, how are you? Yeah?
Yeah, Miss George is really nice. She's probably like one of the best things like you could ask for in a therapist. She always let me be open. She let me like be myself, be authentic. She let me know a lot that therapy was for me, and she was always there for me. My name is Tyler. I'm 18 years old, and I'm a recent graduate of Girard College. I don't think a lot of people talk about mental health because it's had a negative stigma for a very long time. Like, oh, you have depression. Like, no, that's not real. Like you just had to get over it, which is not. It's not true, because it's very real. And you know, me personally, I deal with it. There were a lot of days where I didn't want to get up out of bed, or I just took the day to myself. So like, it did start to impact my grades and my social life. This year, specifically, was a really hard year. March 14th was probably the darkest day I faced. I tried to commit suicide, and I ended up going to a program, which helped me a lot to understand about myself. And then Miss George and Dr. Sandoval, they just helped me to come to see the positive things that in myself that everybody else sees, and like just to keep pushing myself to go forward and to keep putting in the work to get better.
And Tyler allowed us to work with him, and he was all in and made some amazing progress this year, and I am excited for his future plans and who he's going to be.
I'm going to school in Kentucky, and I'm just looking forward to going to a new environment where I'm able to have an impact and use my voice for good. Kids need to feel empowered about certain things, especially about mental health, because so many kids deal with it and they don't even know.
I know that mental health for our students is super important. We've got to make sure that we meet the social and emotional and mental health needs of all of our children. School districts cannot do this work alone. We need help with conveners like Independence Blue Cross Foundation that brings us together, because that collaboration is always good for children.
With the support of the Independence Blue Cross Foundation, CHOP had the opportunity to establish a school-based mental health program, and we are geared up to expand into schools in the West Philadelphia area.
I hope other kids can experience what I experienced with Miss George. And I don't think she knows like how much of an impact she had on me, but she really did. And you know, I'm gonna miss her when I go down to Danville.
Tyler's a great kid. He's an amazing young man, and my work with him was really pivotal to not just Tyler, but also to myself. Kids don't require a lot. So when you give them a space where all they want is your attention, and they talk about feelings, and you're helping them learn a behavior that's gonna help them as they get older, it's impactful on so many different levels. So it's amazing.